Millions of people around the world struggle with stomach problems every single day. Simple things like eating a meal can sometimes lead to uncomfortable symptoms such as bloating, nausea, or a heavy feeling in the stomach. To help with these issues, doctors often prescribe medicines that improve how the stomach moves and processes food. Two commonly used options are Itopride and Levosulpiride. Both are designed to help the digestive system work more smoothly. But this raises an important question that many patients and even some doctors ask. When it comes to safety and effectiveness, which one is actually the better choice for your stomach? Many people experience digestive symptoms after eating. They may feel bloated, nauseous, or unusually full even after a small meal. Some people also deal with acid reflux or discomfort in the upper abdomen. In many cases, these problems happen because the stomach is not moving food forward as quickly as it should. Doctors refer to this condition as impaired gastric motility, which simply means the stomach muscles are not working efficiently. When the stomach empties food too slowly, it can lead to a range of uncomfortable digestive symptoms. This is where medicines like Itopride and Levosulpiride become important. These drugs help stimulate the stomach's natural movements, allowing food to pass through the digestive system more smoothly and helping to reduce many of these common symptoms. Itopride is a medicine doctors often use when people suffer from persistent stomach discomfort, especially a condition called functional dyspepsia. And many patients with this problem feel bloated, nauseous, or unusually full after eating even a small meal. The real issue in many of these cases is not the food itself, but how the stomach moves. When the stomach muscles slow down, food stays inside longer than it should. This is where Itopride becomes helpful. The medicine works by increasing a natural chemical in the body called acetylcholine. This chemical plays an important role in stimulating stomach muscles and helping them contract properly. At the same time, Itopride blocks dopamine receptors, which normally slow down stomach activity. Because of this dual action, the stomach begins to move food forward more efficiently. As a result, many patients notice reduced bloating, less nausea, and smoother digestion after meals. That levosulpiride is another medicine frequently prescribed for people who struggle with digestive problems. Patients with conditions such as dyspepsia, acid reflux, or delayed stomach emptying often experience daily discomfort that affects their quality of life. Meals that should be enjoyable can instead bring heaviness, nausea, or burning sensations. Levosulpiride works mainly by blocking dopamine receptors in the digestive system. Dopamine normally acts as a signal that slows down certain stomach movements. When this signal is blocked, the stomach muscles can contract more effectively and move food forward into the intestines. This process helps speed up gastric emptying and improves overall digestion. Because of this effect, many doctors prescribe levosulpiride to help reduce symptoms like bloating, reflux, and early fullness after eating. For many patients, the medicine can bring noticeable relief, allowing the digestive system to function more smoothly again. At first glance, Itopride and Levosulpiride may seem very similar. Both medicines are used to treat digestive problems, and both help the stomach move food more efficiently. However, the way they work inside the body is slightly different, and that difference can matter. Itopride works through two important actions. It increases acetylcholine levels, which stimulates stomach movement, and it also blocks dopamine receptors that slow digestion. This dual mechanism allows the drug to support stomach motility in more than one way. Levosulpiride, on the other hand, mainly focuses on blocking dopamine receptors. By reducing dopamine's slowing effect, and it helps the stomach contract more effectively. While both medicines can improve digestion, their different mechanisms may influence how patients respond to them. In some cases, these differences may also affect side effects, safety, and how doctors decide which medicine to prescribe. Over the past 2 decades, several clinical studies have explored how effective Itopride and Levosulpiride are for treating digestive disorders. Researchers have especially focused on patients with functional dyspepsia, a condition that affects millions of people worldwide. In many studies, patients taking these medicines reported noticeable improvements in symptoms. Bloating became less frequent, nausea improved, and meals felt easier to digest. Some comparative studies even placed the two drugs side by side to evaluate their performance. When the interesting finding from several trials was that both medicines often produce similar improvements in symptom relief. Patients in both groups experience better digestion and reduced discomfort. However, researchers also noticed that safety profiles could differ between the two drugs. While effectiveness may be comparable, certain side effects appear more common with one drug than the other. This difference in safety is an important factor doctors consider when choosing treatment. Like all medicines, Itopride and Levosulpiride can cause side effects, although not every patient experiences them. Most people tolerate these drugs quite well, but understanding the possible risks is still important. With Itopride, the side effects are usually mild. Some patients may notice headaches, mild diarrhea, or slight abdominal discomfort, and these symptoms are generally temporary and often disappear as the body adjusts to the medicine. Levosulpiride, however, has a slightly different safety profile. Because it affects dopamine pathways more directly, it can sometimes influence hormone levels in the body. In particular, it may increase a hormone called prolactin. Elevated prolactin levels can occasionally lead to hormonal symptoms such as breast discomfort or other endocrine changes. While these reactions are not extremely common, they are important enough that doctors monitor them when prescribing the drug, especially during longer treatment periods. One important factor doctors consider when prescribing digestive medicines is how the drug interacts with the brain and nervous system. Some medications designed for the stomach can also affect areas outside the digestive tract. Itopride is often viewed as having a more limited effect on the central nervous system. This is because the drug mainly acts within the digestive system and has minimal ability to cross into the brain. As a result, neurological side effects are considered relatively uncommon. Levosulpiride, on the other hand, can cross into the central nervous system more easily. This characteristic allows it to influence dopamine pathways, not only in the stomach, but also in the brain. While this does not mean the drug is unsafe, it does mean doctors must consider certain risks in specific patients. For this reason, some healthcare professionals believe Itopride may offer a safer profile in certain situations. The choice between Itopride and Levosulpiride is not always simple. Doctors rarely rely on a single rule when selecting a medication. Instead, they carefully evaluate each patient's symptoms, medical history, and overall health. For some patients, Itopride may be preferred because it tends to have a lower risk of neurological or hormonal side effects. Its action remains mostly focused on the digestive system, which can make it a comfortable option for long-term symptom control. However, this does not mean Levosulpiride is ineffective. In fact, some patients respond very well to it, especially when certain digestive symptoms are more prominent. Doctors sometimes choose Levosulpiride when they believe its mechanism may work better for a specific condition. Ultimately, treatment decisions depend on individual patient needs, and physicians use their clinical judgment to decide which medicine is most appropriate. Although these medicines can be helpful, certain individuals should use them with extra caution. People who already have hormonal disorders may need careful monitoring, particularly when using drugs that can influence prolactin levels. Patients who take multiple medications also need special attention because drug interactions can sometimes occur. Pregnant or breastfeeding individuals should always consult their healthcare provider before using any digestive medicine. The safety of many medications during pregnancy or lactation may depend on the situation and medical supervision. In addition, people with chronic digestive diseases or complex health conditions should avoid self-medicating. Digestive symptoms can sometimes signal more serious underlying problems that require proper diagnosis. Because of these factors, it is always best for patients to discuss their symptoms and treatment options with a qualified healthcare professional before starting any medication. Digestive discomfort can be frustrating, and for many people, it becomes a daily struggle. Medicines like Itopride and Levosulpiride were developed to help the stomach function more efficiently and reduce symptoms such as bloating, nausea, and early fullness after meals. Research suggests that both drugs can provide meaningful relief for patients with functional dyspepsia and related digestive disorders. In terms of effectiveness, studies often show that the two medicines perform quite similarly. However, safety profiles may differ slightly. Because Itopride tends to act mainly within the digestive system, some doctors believe it may carry a lower risk of certain neurological or hormonal side effects. Still, the best treatment choice is never the same for everyone. Each patient's condition is unique, and the final decision should always be guided by a doctor who understands the patient's medical history and needs.